I'm Freddie Effinger. I'm from Birmingham, Alabama, and in 2007 I was 23 at the time, and the cutoff age for my parents' insurance was 21. So I was kind of in between, hoping that I would get to the job position where I could have employer insurance.
Young people that don't have insurance really are just one accident, one catastrophic illness away from a disaster for the rest of their lives.
In the summer of 2007, this pain that started growing began to get a little unbearable, and so I visited an emergency room. They took blood tests. My white blood cells were fine, so they were thinking perhaps it could be a mass, but there was nothing serious. Once I had the mass removed, they biopsied it, and they learned, as I did, that it was actually Hodgkin's lymphoma. In the span of a phone call, everything changed from planning the rest of my future to how on earth we're going to try and pay for health care. I had no idea how much my treatment was going to cost. I had no idea what kind of treatment I needed. I just knew that it was getting bad. A doctor told me that chemo treatments can be as much as tens of thousands of dollars per treatment. He also told me that the course that he would recommend for me, initially just looking at my case, would be 6 months of 12 treatments. I called the hospital. I spoke with the accountant, and I told her, I'm terrified that this thing is going to kill me, and I can't afford to be treated. What am I supposed to do? And I begged them, literally begged them for my life. The hospital had a program. However, to qualify for it, I had to be declared indigent. And after declaring me indigent, I was allowed then to receive treatment from the hospital without charge. I had to beg for my life, but after begging, the hospital said yes, and I'm alive today. I have bills, I have debt, but I'm alive. But there were individuals that the hospitals would have told them no. What would have happened to me had the hospital told me no is the frightening question that I think about all the time. And the answer is, I wouldn't have survived. This healthcare reform will help to fix the problems that we've had, specifically allowing people to stay on their parents' plans until they're 26 will prevent as many people as possible from falling into the nightmare that I endured.
The great news is that every parent is going to know that they have the ability to keep their children covered on their insurance, getting the medical care that they need. And they're going to be able to go out into the world of work knowing that they aren't going to have to worry about what happens if they get sick.